UroPatient. Tune in and see. Prepare your health for you and me. Knowledge is power. We make it clear every Saturday morning.
Today we're covering how to safely titrate your erectile injection dose. This presentation is for educational purposes only, and you should always follow your provider's instructions. I've had a couple episodes on erection drugs and how to administer them, but I thought, one of the things that I do like to do when I do patient teaching is stress, how do you figure out what's the right dose? And that's a really important thing. I thought, well, this would be a good time to cover that. We call it titration, so that's why it's step-by-step titration guide. Now, penile injection therapy is a highly effective treatment option for erectile dysfunction. And when I say highly effective, we're like 90% effective with getting it to work for most patients, especially for men who don't respond well to the oral meds. The most common injections are Elprocidil, which is Caverject or Edex, and those are the only two that are on the market that you can buy with prescription. And then there's the combinations of what we call Trimix or Bimix. Sometimes they mix one or two or three of these chemicals together. Elprocidil, papaverine, and phentolamine is the real common one. Trimix is the one I use the most of because you can use such small dosages and it allows a lot of adjustments of the doses. It just works really well. And then Bimix is just papaverine and phentolamine, which has been around that was actually the first drug ever used to treat with, erection problems with injections. But it had a lot of problems. Papaverine especially is kind of irritating to the fibrous bodies of the penis, can cause scar formation and such. So again, Edex, Elprocidil, pretty safe and easy on the penis. Trimix, because again, it uses such small doses of the papaverine and phentolamine. I'm pretty happy with those as options. Don't really use Bimix. Now, these medications are injected directly into the side of the penis using a very small needle, producing a reliable erection within 5 to 20 minutes. Many men appreciate that injections work quickly, are controllable, and can create natural feeling erections suitable for sexual activity. Now, I'm talking perfectly normal erections. With proper training on dosing technique and safety, penile injections remain a safe, customizable, and confidence-restoring therapy. Now, the ones you see in the picture here, those are the ones that you can buy by prescription. The top one is the Caverject, the Edex. You can pretty well see its label. And then Super Trimix is just the name for Trimix. Those come from compounding pharmacies. These are pharmacies that specialize in mixing these up for patients. So it's really, if you have to pay out of pocket for these drugs, the other two probably could cost, I've heard, upward to $100 per injection. Where the Trimix compounded pharmacies, they can come down to $5, $10 an injection or less. Now, here's the most important thing. Well, I don't like how that needle looks going into my arm there. Dose titration matters because it ensures that erectile injection therapy is both safe and effective for each individual patient, meaning there's no perfect dose for one person, for every person. It's individual. Every man responds differently to medications like the Trimix or the Elprocidils. Factors such as age, vascular health, nerve function, and previous ED treatments all play a role. Starting with a low dose and gradually increasing it under medical guidance helps identify the minimum effective dose that produces a firm, lasting erection without the risks such as prolonged erections called priapism, pain, or bruising. Proper titration also helps build confidence, reduce anxiety about injections, and allows patients to learn correct techniques while minimizing complications. In short, dose titration is essential for achieving predictable results, optimizing sexual satisfaction, and maintaining long-term penile health. Now, once again, I'm going to stress the fact that the injections are probably the only thing that can give you pretty much a normal erection, with one exception. Normally, when a man ejaculates, the penis will pretty well go down to a normal soft penis. But with these injections, your penis is going to stay hard reliably for a time frame based on how long it takes for the medicine to break down. For most men, it could mean a half hour to even an hour erection, which is unusually long for most men. So it does provide a little bit more, longer lasting erection. And that's why titration can sometimes tune it up to where a certain amount of medicine is necessary to kind of get you over the edge and get it to lock in as an erection. And then more medicine just makes it last longer. Men have a way of thinking more is better. It's not. You want to go start low and go slow with your increasing your dosages. That's the real key factor. Also, to tell you one quick story here. We used to have there was a psychiatrist who would treat what we called anxiety-related erectile dysfunction. So, we call, based on nervousness, the guy couldn't get an erection. And that's a real thing. Well, he used to start sending patients to see me because with my injections, I was having higher success rate than he was having with his psychotherapy. So once guys they knew they had the injection in their, back pocket, so to speak, that they could kind of have that confidence, they no longer needed it. Most of the time, within 6 months, they were back to normal. So, this injection, I've been doing this a long time, and it's just really been remarkable. One you don't want to miss if you're having struggles with erectile function. Now, healthcare providers intentionally start erectile injections therapy with low initial doses to ensure maximum safety, as every patient responds differently. So, as I said, start low, go slow. Beginning with a conservative dose also helps reduce the risk of complications such as priapism. That's the biggest risk with this drug, is an erection that won't go away. Sometimes it just locks in and won't unlock. Or excessive penile discomfort. There has been some patients who do get some discomfort, some aching in the penis with this. It's pretty rare, but it does happen. For this reason, the first injection should always be performed under medical supervision, allowing the provider to monitor the patient's response, confirm proper technique, and make immediate adjustments if needed. The supervised first dose forms the foundation for safety, effective titration as the patient begins treatment at home. And I can tell you that in my practice, what I would do is have the patient come in, and I would start with a very, very low dose. We can kind of see in those syringes there, those are marked from 5 to 50, some are from 10 to 100. We typically use insulin syringes because they've got the right size needle, and a full syringe is usually 1 cc. And I like to start with 1/10 of a cc. So what I can do in the office is train the patient how to inject themselves and start with that very first dose at 0.1, just 1/10 of a cc, and see what the patient's reaction is. Now in the office, if they get no erection at all, what I'll do is I'll have them give another shot at a higher dose. So maybe 2/10 more, bringing it up to 3/10, and see how that works. And then based on how long it lasts, we can kind of start working with where we need to go. Other options are just to send patients home after they learn how to inject themselves and increase it by just 0.1, that 1/10 of a cc. So like I said, mostly I use what you see there are the 0 to 50. I use the ones that are 0 to 100. So they go 10, 20, 30, 40 units. A unit is 1/10 of a cc. So you want to just go up by very slow amounts, 1/10 of a cc. Eventually you're going to get that good erection, and it's going to go away in less than an hour. That's the ideal. So increasing your erectile injection dose safely and gradually under a careful monitored process, like I just talked about, is key. So after the initial supervised dose, patients should incrementally adjust their medication based on, and I always write it down, what I think they should be adjusting to. And if it's anything different than that, they should be calling me. They should be made only after observing how previous dose performed. So again, you need to come in. We need to see what's going on. This is not the thing you send somebody home with and say, here, try this. Now, following the slow, stepwise approach minimizes problems like priapism, ensures optimal effectiveness, and allows patients to find the lowest effective dose that consistently produces satisfactory erections. One of the things patients really find I find interesting with dealing with this is when they inject themselves, they don't realize that it's really not a very painful injection, and they're surprised to find that out. Some don't even know they've given themselves the shot. Well, the needle's very small. It's like the size of a hair almost. And the area that we inject, the side of the penis, especially towards the base, this area right all the way back here on the base of the penis, has less sensors, less pain sensors than like the tip of your finger would have. So if you stuck yourself with a needle, even that needle, in the tip of your finger, you're going to feel it. But penis, you may not feel it. You may feel it, you may not. Now, when titrating injection therapy, the goal is to achieve an erection that is firm enough for sexual activity. So, we wanted to have something you can perform with. That's the ideal. Comfortable for the patient, and key here is time. It should last under an hour. You should pay attention. This is not the drug you want to start out using and giving it to yourself right before you go to bed, and then you wake up and find out you still got an erection. An ideal erection provides sufficient rigidity for penetration without causing pain, numbness, or discoloration. Duration longer than 1 hour can increase the risk of those complications, and especially priapism, and a risk where the erection doesn't go away. Now, while the erection that is too short or soft may indicate the dose could be too low. So sometimes you do want, you don't want to always use a dose that's suboptimal. So again, you have to go up and kind of adjust it. Be patient. Patient comfort, again, is paramount, as injection should not cause undue anxiety or physical discomfort. Achieving the right balance assures effectiveness, safety, and allows patients to confidently use the therapy for sexual activity. Now, it's crucial never to increase your erectile injection dose if the current dose produces an erection that is too long, painful, or accompanied by side effects such as bruising, swelling, or numbness. Extending the dose under these complications can lead to a serious complication called priapism, a prolonged, potentially damaging erection. Priapism is we consider a medical emergency because if it's left untreated, you can have permanent damage to your penis. Any signs of discomfort or adverse reactions indicate the dose is already too high, and further increases should be avoided until you consult with your healthcare provider. Prioritizing safety over potency ensures effective treatment while protecting penile health and overall well-being. Did you ever wonder where the word priapism came from? Well, priapism originates from Priapus, a minor Greek god of fertility, gardens, and male genitalia. And of course, I was kind enough to have a picture of him for you. He's often depicted as having an unusually large and permanent erection. Now, priapism is no joke, folks. It's prolonged erection. We consider anything over like 4 hours as considered priapism, an erection that won't go away in 4 hours. Often painful. It starts to really hurt when it stays that long. And and it can occur without sexual stimulation. It's a medical emergency because prolonged engorgement of blood in the penis can cause tissue damage, permanent erectile dysfunction, or scarring if not treated properly. Patients experiencing priapism should seek immediate emergency medical care, as timely intervention often involves medication or drainage procedures that can prevent long-term complications. Understanding priapism, recognizing these warning signs, and acting quickly are essential components for safe injection therapy. Now, we even have a thing where we send patients, when I give out information, it has a reversal drug that patients can be injected with in the emergency room. Not all emergency rooms are familiar with what to give to get rid of a priapism. And if the urology on call is they're tied up and they can't get down there quickly, it's kind of helpful to have this. So it's always good to ask your doctor if there's a remedy that they could provide you that you can give to the ER if you have this problem happen. It's rare, but be prepared. That's what I say. Because when it happens, it's nice to be able to just get by with just a quick shot of a reversing drug. And that's most of the time will do the job. Not always, though. Sometimes it has even needed surgery. So not to scare you away, if you follow all the right instructions and have a safe system in play, you'll do fine. And proper injection is important because you got to make sure that you're getting this into the muscle. As you see in that picture up there, the technique for injecting it, you've got to bury the needle. Now, some people will just kind of poke it underneath the skin and not into the muscle. And then you'll kind of see sometimes a black and blue from that. But you're not getting the effect. So then you think you need to increase it and give more. Well, actually you didn't. You just didn't inject it properly. So make sure you bury that needle to the hub. I always say you can't put it in too deep. Don't worry. And then proper placement like we see here on there. You don't want to inject way up on the top because there are some nerves up there that can get pretty sore if you inject into them. And you don't want to inject on the base of your penis, the bottom, because that's where the tube that carries the urine runs. That's the urethra. And if you inject it in there, you're going to probably see some blood come out of your penis because it'll cause a little bleeding in the urethra. Not dangerous or damaging, but it's just not going to work either. So we say 2 o'clock, 10 o'clock, and rotate. You don't want to always inject on the same side. So very important to rotate left to right. I always say every time you do it, switch sides. Cleaning the site with alcohol reduces the risk of infection, so wipe it down first. Also, after you inject it, pressure on the injection site. You want to prevent bruising. You don't want a black and blue to form there or a hematoma, blood under the skin. So always put a little pressure on there for about a minute or two to kind of help prevent that from happening. You follow all these steps I'm telling you, you're going to have a great result. Now, I think that this is something that people don't always do, but it makes a lot of sense. Keep a detailed log. Crucial part of safe and effective injection therapy. Patients are encouraged to record each injection dose, how good the erection was, and its duration, and any side effects that you might have had, pain, bruising, swelling. This record helps both you and the healthcare provider, because when you come in for your visit, you can show it to us and gives us a lot of information as to what's going on. We may want to change a drug. Maybe there's a better mixture that we think would work for you. I've had patients who failed what we call Trimix, and I've come up with a formulation called Quad Mix, Super Trimix, Super Duper Trimix. And again, success rate for getting an erection, about 90, high 90s. So it's pretty high percentage. So you keep track. It's a lot of information that we can go through and figure out better treatments for you. And then also, it's crucial that we tell you about this, but it's important for patients to recognize red flags when using erectile injection therapy, as these signs may indicate complications that require prompt attention. Any erection lasting more than 2 hours, and absolutely any erection over 4 hours, severe pain, noticeable bleeding or swelling, or inconsistent results with the same dose should not be ignored. These warning signs might be a signal that you're at risk for priapism. Improper injection techniques or adverse reaction to the medications should also be reported. Promptly contacting a healthcare provider ensures timely intervention, reduces the risk of long-term damage, and helps maintain the safety and effectiveness of the therapy. And I'll give you one more quick story. I had a patient call up. He was going on an out-of-the-country flight. He had over the seas. He was supposed to fly out and decided that he was going to have sex that night. And about 2 in the morning injected himself. Now he had a 10 o'clock flight at 10 a.m. 2 a.m. he gives himself the injection. At 6 a.m. when I finally got into the office, he's got a call on our machine, and I call him back and he still has an erection. And he's like, I got to get on a flight. Well, I mean, that was bad planning. You don't want to be trying to go on a flight when you've got a risk for a priapism. The patient had to cancel out his flight, miss his flight, and it did get resolved with just some drugs, but nonetheless, plan ahead. If you're going on a long overseas flight, that's not the time to use the medicine. And then finally, successful erectile injection therapy relies on prioritizing safety, following a slow titration process, maintaining open communication with your healthcare providers. Patients should increase doses gradually, carefully observing how their body responds to each adjustment, rather than attempting rapid escalation. Follow the provider's instructions regarding technique, dose scheduling, and warning signs help minimize risks such as priapism, pain, or tissue damage. Regular communication ensures any concerns or unusual responses that are addressed promptly, reinforcing confidence, effectiveness, and long-term safety throughout the therapy. So hope you like my AI generated guy talking. I thought, hey, why not? I'll try it just for fun. But anyway, enjoy UroPatient every week, coming to you with more information, and we'll see everybody again next week.